This is Democracy Now!, democracynow.org, the War and Peace Report. I'm Amy Goodman. We're joined by Dean Baker, economist and co-director of the Center for Economic and Policy Research. The big buzz is privatizing Social Security. That Social Security is what's breaking us. It's not affordable. Dean Baker, I'd like to ask you what I asked you during the broadcast, that it's not affordable. Explain your response to this.
Well, it's really absurd on the face of it. I mean, the program has a separate stream of financing. We all pay a Social Security tax when we work, 6.2% of our wages, and employers contribute 6.2% on behalf of workers. And that actually has been running a surplus. We've been paying more into the program than benefits have been paid out. This was a design that was put in place by the '83 Greenspan Commission. They raised taxes. They also raised the retirement age. It is going up to 67, now 66. And the result of that is that there's been this huge surplus run, over $2.5 trillion over the last roughly 25 years. And the program's supposed to continue to run a surplus for a bit more than a decade, at which point we're supposed to start drawing down on the money in the trust fund, the money that we've accumulated. So this idea that somehow we can't afford this, we've actually been paying more than was needed for benefits, and according to the Congressional Budget Office, the program as it currently stands could pay all scheduled benefits through the year 2039 with no changes whatsoever. Now, when you go further out, 2049, 59, 69, at some point you are going to be facing shortfalls. The main issue there is people are living longer, and at some point you're either going to have to increase what you pay in, some source of revenue. You could raise the cap. There's different ways you could do that, or some cut in benefits or raise the retirement age. But this is well into the future. So the idea that, 5 years, 10 years, 15 years out that we're facing some crisis, that's just simply not true, and everyone who's familiar with the situation knows that.
Federal Reserve Chairman Ben Bernanke has warned that entitlement programs like Social Security and Medicare will have to face cuts. This is what he told the House Budget Committee last month.
The entitlement programs are not self-funded. They're unfunded liabilities to a significant extent at this point. They are the biggest single component of spending going forward. Now, there are various ways to address this. You can restructure entitlement programs. You can cut other things. But at some point, you need to address the overall budgetary situation. If you don't, you'll get a picture like this one where interest rates are rising, interest payments are rising because the debt outstanding is growing exponentially. And at that point, things will come apart. A famous economist once said, anything that can't go on forever will eventually stop. And this will stop, but it might stop in a very unpleasant way in terms of sharp cuts, a financial crisis, high interest rates that stop growth, continued borrowing from abroad. So clearly we need to get control of this over the medium term, and we're certainly going to have to look at entitlements because that's a very big part of the obligations of the federal government going forward.
Economist Dean Baker, your response.
Well, this isn't the first time Mr. Bernanke has misled Congress on something very important. You recall he was a big factor in pushing for the TARP and fundamentally misrepresented the situation in financial markets to get Congress to approve it. But he's done the exact same thing here. Again, he uses the term entitlements. A lot of people here in Washington do that. They know better. Again, the story with Social Security, we're all looking at the same numbers. Ben Bernanke would not, if we had him here, tell you anything other than what I just told you, that the Congressional Budget Office says the program can pay all benefits through the year 2039 with no changes whatsoever. Relatively minor changes would keep it fully solvent decades more into the future. The bigger problem is Medicare and Medicaid. But again, Mr. Bernanke knows full well it's not that those programs are out of control, it's that our health care costs are out of control. So the real problem is that we have to fix our health care system. We pay more than twice as much for our health care per person as people do in Germany, in Italy, France, Canada, whatever country you choose to pick. If our per-person health care costs were the same as what they are in those countries, we would be looking at enormous budget surpluses for the indefinite future rather than deficits. The problem is that people like Mr. Bernanke don't want us to challenge the insurance industry, the highly paid medical specialists, the pharmaceutical companies. Instead, they're saying cut Medicare, Medicaid for the elderly. So it's just really a dishonest story. The issue here is health care. That's what we should be talking about.
So, Dean Baker, what did the so-called landmark health care legislation do?
it extended coverage to a lot of people that wouldn't have had it otherwise. So in that sense, I think it was a very good thing. It also established community rating so that people who get sick and lose their job could still hope to get covered, because otherwise, typically, people, when they lose their job, no one is going to cover them if they have a serious health condition. So in that sense, I think it was a big step forward. But in terms of covering, controlling cost, it's really hard to see that accomplish much. We have to go back to the drawing board, and what's really pernicious is you have all these people running around Washington saying, oh, we tried that, we didn't get anywhere, so now we have to cut Social Security, we have to cut Medicare. That's not acceptable.
You've just put out a report on Social Security. You look at the impact of the three common proposals for cutting Social Security and the impact they'll have on retirees. Tell us.
Yeah, well, what we looked at, three things are often suggested. One, raising the retirement age, and this is an accelerated increase because, as I said, it's already scheduled to go up to 67 for workers who hit age 62 after 2022. So it is already going up, but they propose to accelerate that and push it up to 70. Secondly, a change in the benefit formula so that workers will be getting less who retire, say, 3, 5, 10 years out than they otherwise would have. And the third one is a change in the annual cost of living adjustment. Currently, it's tied to the Consumer Price Index. There are proposals actively being debated that would reduce that by about 3 or 4/10 of a percentage point a year. Not too long ago, they were talking about doing it by 1% a year. Now, all of these would lead to substantial cuts in benefits, and the point we make in this report is not just that they cut benefits, but it's a very large cut in retirement income. The big issue here is that most middle-class workers have taken a very big hit to their retirement income as a result of the collapse of the housing bubble. For most middle-income workers, most of their wealth was the equity in their home, which in many cases got wiped out with the plunge in house prices. In addition, they lost money in their 401ks as well, if they had any. And remarkably, when people talk about cutting Social Security down here, almost no one seems to have noticed that we had this huge collapse of the housing bubble that's destroyed much of the wealth of these near retirees who they want to cut benefits for. So if you want to talk about cutting benefits, 30, 40 years out, and we could have that discussion, I still wouldn't be terribly anxious to do it. But we could see these people. We know that someone who's 52, 53, and basically has almost nothing, the typical wealth of someone in there between 45 and 54 is about $80,000, counting the equity in their home. That's a middle-income household. They're not going to have much for retirement. We know that. They don't have many more years in the workforce. They're not going to be able to have huge savings. So when you talk about cutting their Social Security, in many cases, that's almost one-to-one a cut in their income. If you cut their Social Security 5%, you're cutting their income 5%. That's a very big hit.
Dean Baker, put all of this in the context of the passage last week of what is called the landmark financial regulation bill.
Well, I guess what I'd say is the regulation bill, again, it had some good aspects, but I think long and short, the banking industry, the financial industry got off incredibly cheap, because here we're suffering incredibly. It's, again, I hang out with people in Washington who are all employed, but, you look around the country, we have an unemployment rate that's close to 10%, and what's more, it's expected to stay there long into the future. Those people didn't do anything wrong. You have people who lost their jobs in the construction industry and the manufacturing industry, retail trades, every sector of the economy. They can't find other jobs. It's not that they're lazy, they're unwilling to work, or they don't have the skills. It's we messed up. We, meaning the people who run economic policy, they're sitting there unemployed, and the people who made out like bandits from it are those on Wall Street. And what they get with the financial reform is, they can't do a little of this, they can't do a little of that. But basically, their profits, their bonuses are going to be largely unaffected. They're still going to be incredibly wealthy. I suspect most of them are laughing pretty hard right now.
Speaking of Wall Street deals, what about the deal with Goldman Sachs that they would pay, $550 million as a fine?
Well, that's a tough one. You get to some technical issues. Suppose the SEC had carried this suit through. They'd brought suit against Goldman Sachs. Could they have gotten more money? It's hard to say. If you actually carry these things through, they get fairly complex. You don't know what judges will rule. You don't know what if it went to a jury. I don't know how the trial would proceed. But in any case, I don't know what they would have come up with at the end of the day. So I can't necessarily take issue with the 550 saying it was too small or too large. I wouldn't say one or the other. What I would say is the question is, do we really think that this is going to change practices on Wall Street? This particular case was so egregious. I mean, it was almost Goldman Sachs put it up on a billboard. We're ripping off our clients. The vast majority of cases where they're engaged in improper behavior of different types, it's not so egregious, it's not so clear-cut, there's not such a clear trail. So I was glad to see them pay what I consider a reasonably, stiff fine. Goldman's, they aren't going to, I don't think anyone's going to, go hungry because of this. I mean, it's a company that's going to make, somewhere in the order of $10 billion a year in profit.
Well, they made it back in after-hours trading.
$22 billion.
They made it back in after-hours trading that night.
Yeah, so this is not going to hurt them in a big way. The question is it the sort of sanction that's going to make them think twice about engaging in improper behavior? My guess is that basically what it does is it tells them you got to be a little more careful. Don't put up neon signs. Cover your rear.
We are coming up on the 75th anniversary of Social Security. Can you talk about why FDR originally established